I'm Francis Norton. I'm a counsellor. I specialise in burnout, recovery and avoidance. So, what is burnout? How does it show up in people's lives? Or it could be someone who loves the challenge of their job, finds it really rewarding, but lately they've started waking up and dreading the day. Maybe they're getting to their desks and procrastinating, starting to make mistakes. We could have someone who's really engaged with their work. Maybe they've just been promoted, but they're starting to bring the stress home, arguing with their partner, maybe avoiding them. Their coping mechanisms that used to work aren't working anymore, and they're turning into someone they didn't recognize, someone they don't want to be. We can get someone further down the line who's actually been along to their doctor, been signed off work with stress, but it's been a few weeks now and they're not feeling any better, not feeling any different. And now they're starting to wonder whether they'll ever go back to work. How do you define burnout? World Health Organization recently gave us a 3-part definition, which included emotional exhaustion, growing feelings of negativity, the loss of value of yourself or others, and growing feelings of ineffectiveness, no longer able to get stuff done, to make a change to your world or your own life. All this is building on an understanding of burnout, which started in the 70s and 80s when Freudenberger first identified and wrote about it, and left us with his 12 stages of burnout, starting with the compulsion to prove oneself, overwork, neglect of needs, ending up with inner emptiness, depression, and full burnout syndrome, medical intervention required. So how does this happen? Well, it's fairly obvious that it starts with stress. A little stress is no bad thing, as long as we get a chance to recover. But persistent, unresolved stress can result in us feeling run down. This has physical consequences. You might have difficulty sleeping, gastric problems, blood pressure, going down with bugs that you would have shrugged off in days gone by. And it can have relational consequences. Your body's in a fight or flight state and you can't offer or accept emotional support. The problem is, if this keeps going, as your inner resources get more and more exhausted, you can find that even smaller, everyday stresses start to become overwhelming. And at this point, the stress response has started to become self-perpetuating, and that's what I would call burnout. So, how can counselling help with burnout? Firstly, it can provide relief from the burnout state of mind, the perpetually stressed state of mind that makes it hard to think clearly. The great thing about the counselling relationship is that it is a place where there is no judgment, no criticism, and there is an understanding that these thoughts and feelings are not actually you. They're just part of the burnout. And that little element of separation allows you to step back, to think about what's going on in your life. What are the stresses in your environment, and how are you relating to them and managing them? And at this point, we can start the recovery and say, what would it look like to be able to relate to these stresses in a different way, or to make changes in your working environment? What would you have to do? What do you need others to do? And how, ultimately, how can you reconnect to the energy of your dreams and plans and goals? And then the third way that counselling can help with burnout is regrowth. As part of your recovery, you find yourself reprioritizing your life. Maybe you become less identified with your professional goals, more concerned with personal growth, and with deepening and strengthening your relationships, which is, of course, the best defense against these stresses in the first place. Wherever you are on your journey, into or out of burnout, counselling can help. You can find me in the counselling directory or at burnoutcounselling.com, or search the counselling directory for counsellors who specialise in burnout. We can help. Look after yourself.